Hi guys! Kumusta po kayo dyan? So today, Wade and I decided to have a little chit-chat, just sitting here on the couch.
We wanted to talk a little bit about, just a little bit about ourselves and about how the enhanced quarantine, or whatever you want to call it, the Chinese scourge, the virus, whatever you want to call it, how it has affected us. And it's because it's affecting everyone all around the world. Learni is a teacher by trade when things are normal. And I work in surgery at a hospital, surgical tech. I assist during surgeries. And Learni has been out of work since the first week of March.
Yeah.
Yeah, they closed schools at spring break and they've never gone back. I worked right up until the end of March. Just about the end of March, just right before the end of March. And then they shut us down and for no elective surgery. So we could only work with our cancer patients, patients who had a break, a fracture, bone somewhere, or nerve damage, some kind of pain that they couldn't stand. Those things they'd let us go ahead and do, but to replace a hip or knee, we couldn't do it unless the pain was just so unbearable they affected their quality of life.
Yeah, and also talking about the coronavirus pandemic, it has affected not only our physical health, but also our mental health. And today, there was a headline on Yahoo News about a doctor who committed suicide because of this. It said in the report that her brain was affected because she got the corona, and she got well, but then after that she had to go back to work because she's in New York, and we know that in New York it's really terrible there. It's like the epicenter of coronavirus here in the US.
We don't know, we never knew the lady. We just thought that to commit suicide there has to be, but that's very presumptuous. But suffice to say, this has affected a lot of people very badly. So it is no joking matter, even though I know I always say the Chinese scourge. It's not a joking matter. And it has affected all of us to a certain extent. We're lucky. I mean, Learni hasn't been able to work at all, and my work has been sparing, although now it's started back. And that's one of the things we're going to talk about today.
Yeah.
But we've actually been very lucky through this, and I know so many haven't. So our hopes and prayers and everything go out to all the people who've been affected. And even though I'm in the medical field, I really technically haven't had to be a frontliner. The patients that I have worked on this month none of them have had the virus. So our environment's been very healthy. So we just want to get that out there. First of all, we really pray that this thing's over soon and with as little loss of life as possible.
Yeah, and the reason also why I talk about the mental health and the suicide of that doctor was because earlier today, when you were at work, I was checking on my mental health also. I stayed up late last night, and then when I woke up, it was already very late, like 11 a.m. So I had my brunch. I was like checking on my personal mental health, and I know when I was still in the Philippines that whenever I feel like I'm so tired, I had anxieties, my outlet was a karaoke. So while Wade was at work today, actually this was his first real come back to work.
Yeah, pretty much. The kind of our quarantine here in the state of Texas really gets to open back up on a phase 1 basis, I guess, tomorrow. I got to work today. We did cases today, and it was really good to really kind of just for real be back to work, not just for one case. Or I know it sounds weird. I never thought I would say I was so anxious to go to work, but I was so anxious to go to work. So it's great, and next week I'll be working full time. So Learni already does the majority of the work on all these videos anyway. I mean, the vast majority. Basically, all the work I do is in front of the camera, and then I'm done. She does it all. But from that, starting next week, it'll be late in the day, so she will have some late evenings editing and putting together. But it's just, I don't know. I don't know. One, we just wanted to tell people to hang in there. This is going to pass.
Yeah.
And we can see light at the end of the tunnel.
Yeah, we're almost there.
We're almost to the finish line on this thing. And even though we still will need to practice the social distancing, I mean, even at the hospital, everybody has to answer a questionnaire. They have to get their temperature taken before we let them in the door. Every patient has to be tested before we can take them to the operating room. I mean, it's still all a big deal, but it's still life starting to get back a little more towards normal. So for everybody out there, please just hang in there. You know, with prayer, we will get through this thing. And, you know, mental health days are okay to have. It's okay to sing karaoke for 3 hours at home by yourself. You know, that's perfectly fine. If that helps you get through, because this is going to end. And our prayers are just with all the families who have been affected.
And by the way, guys, we are here in Texas, USA, so that is our current situation about the coronavirus right here. Okay, guys, that's all, and we would like to invite our viewers, if you like our video, if you think that our channel will help you, please don't forget to give us a like and subscribe. And also hit the notification bell so you will be notified of our new uploads. Bye, guys! They don't match.
I know they don't match. They never do. Okay. The difference between you and me. If I put on socks that didn't match, it would drive me nuts. Even if I had shoes on and I couldn't see them, I would know. It doesn't bother you at all. That's awesome. Anyway.